Hi, I'm Thain. I'm with Eastside Birth Center in Bellevue, Washington State, and I'm just here to answer a few questions for you that most people have about midwives. People generally come and see a midwife because they are very well trained and very educated, and they are very personalized in their care. Prenatal visits in our practice are scheduled for 45 minutes to an hour, and the time that we spend with people is not just the nuts and bolts of palpating an abdomen and listening to fetal heart tones and things. It's really getting to know the client on a one-on-one relationship and building a relationship with them, because that's really important. Birth is a very intimate time and a very intimate experience. And you want to make sure that you get to know that individual so that they feel comfortable with you at the delivery and have a relationship and a rapport with you and a trust. And we're building that relationship and rapport throughout the prenatal care. So we spend a huge part of the time just sitting and talking with the client and answering all of the questions. Here at Eastside Birth Center, I've been in practice for 12 years and have delivered over 500 or 600 deliveries at this point. We do both birth center and home deliveries depending on what the client wants, because wherever they are most comfortable is where we want to be with them. So we do both. I'd say probably 90% of clients choose to be in the water for their deliveries. They are most comfortable there and seem to be most relaxed. We see a lot less perineal tearing when moms deliver in the water. It's just a great place to deliver. Certainly throughout the labor process, we are monitoring things very closely. We're monitoring baby and mom to make sure that things are progressing normally. If things start to slide towards being outside of the realm of normal, in that scenario we have backup physicians that we work with that we can transport to should that occur if it's a non-urgent scenario. Say a mom's in labor for 32 hours and finally looks at us and says, gosh, I need an epidural, I need some rest, I need some pain relief. In that scenario, we would transport to our backup physicians. If it were an urgent scenario where mom came in and, say, the water broke and we had a cord prolapse, cord came out with the water breaking. In that scenario, time is of essence, and we would transport via 911 in an ambulance straight over to the closest hospital to the birth center here, which is about a 3 to 5 minute trip, so it's very quick. And then we would contact the hospital that we are going to and let them know we're on our way so that they can be pulling people together to get everything ready so that there's very little time lost. An urgent situation happens less than 1% of the time, so I wouldn't be doing this job if it was any more than that. I want it to be safe, and I want to have safe, happy deliveries, but I'm prepared to handle it if need to. Thank you for listening. I'm Thain at Eastside Birth Center, Bellevue, Washington State. Please don't hesitate to contact me at any time through email if you have any further questions.